Every year in the month of November, we celebrate National Diabetes Month. And on the 14th of the month, we celebrated World Diabetes Day. That is around the world, everyone comes together, and we're talking about the successes that we've had in managing diabetes. The fact is, though, we're actually not winning the war against diabetes. There are over 1 billion people on the planet right now that are diabetic or pre diabetic, and the numbers are increasing. And the question is, what do we do? And it seems to be one of those questions that continues to elude us. We've not used the word pandemic yet. We've not used the word epidemic yet. We continue to talk about how we manage diabetes. And every time you turn, there's a new drug that's out on how to put our diabetes in the box, how to put the genie back in the bottle. Well, tonight we're going to talk a little bit about what diabetes is, how does it affect us, and can we actually do something about it? And if we can do something about it, what do we do about it? Hey, this is Dr. Dwain Woode. If you're new to me, welcome to the channel. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level. I'm talking to adults with type 2 diabetes who want to put their diabetes in remission, who want to get off of diabetes medications, who want to improve their health metabolically. In fact, to a lot of people who want to reverse their diabetes. If you're new, go ahead and put new in the comments because I'd love to welcome you with a hand clap and some music to let you know that I'm excited that you're here. If you do have questions, go ahead and put those questions into the chat because we'd love to get to those as we get into the evening. You know, there's so much that we've been doing. If you've not already done so, make sure you get over to our channel, and there's several playlists that we've done. We are in the New Year, New You process, right? So we started this, and the goal of all that we've done for this entire year is how do we reverse diabetes? And this, I thought, would be a great time to come back and do just kind of a general review of diabetes and talk about some of the specifics that are going on. Sometimes we get lost in the weeds, but we're going to try to clarify that for you tonight as we move into the show. And like we do, I've got over to my side here, let's see, I've got my monitors that we're going to take a look at to see what my blood sugars are. And then right below, that's my Dexcom Clarity report that we're going to take a look at to see what's been going on with my blood sugars over the last day. In fact, we'll go back a little bit to see what's been going on since I ended my fast. What was that, 2-3 days ago? You guys were with me, and we'll move through that space. I do see some community members that are out there. Just want to say a hot shout out to you all. I see Teresa. Let's see. Let's grab this screen. So I see Teresa. She says, "Hey, doctor and everyone." Steve is saying hello. Steve said hello, Teresa. Teresa back to Steve. And then I do see some of you over there on Instagram. So thank you for coming through and hanging out with us as well. Whatever platform you're on, whether it's Facebook, Instagram, LinkedIn, Twitch, and of course here on YouTube, welcome to the show. And for those of you who are listening to this on the replay, or for those of you who are listening to this on our podcast, we welcome you as well. Just a lot of stuff that we're going to do tonight. So let's get to it. Let's get to it. I want to first go and let's take a look at blood sugars, right? So let's do this guy. So right now you'll see on the screen that is my current blood sugar. That's my Libre. And as you know, I have two monitors on, one on each side. This one, let's see, let me feel it. This is the Dexcom G7, and this is the Libre 3. I think this is a Libre 3 Plus. And so I wear those, and you'll see on the screen right now, that is what my Libre 3 is saying. And then here is my Dexcom G7. And let's look at this one. And you'll see for most of the morning, let's see, there we go. So my blood sugar has been 150s, 130s, and then as we got into the evening, of course, dropped down into 120s. If I go back and look at a 24-hour, we were right at 150s maybe yesterday evening, and then we ate, and that got up. Look at that, up into the 200s, and then back down into the 120s, 116s by this morning. And then I'm thinking, let's see, right there, that's my toothpaste. You guys see that? That's toothpaste. And then that came down. And then I had lunch right at about 12, 12:15. And so I had a salad, delicious salad that I got from the cafeteria. And what else did I have? I had a salad and some cream of broccoli soup. And so you went up to 150s and back down. And then got home this evening, and I made some jerk chicken over the weekend, and then I had some curry chicken that I had made maybe last week sometime. So we had leftovers, and so I had that, and then two tablespoons of peanut butter. All right, so that's what I had for dinner, and that was probably right at about maybe 3 hours ago. So let's see, here we are now. So 3 hours, let's go back to right here, right? So you'll see that the chicken and the peanut butter really didn't do much to blood sugars. Okay? All right. So anyway, so that being said, let's go ahead and let's take a look at my monitors. And so Keto Mojo and Contour. And we're gonna do this quickly because like I said, there's a lot we want to talk about when it comes to diabetes. And if you do have questions, right? So this is a great time to jump in and drop some questions about diabetes in general. As a matter of fact, any question that you have about diabetes is fair game, right? We are diabetes awareness, so we want to answer whatever questions you may have about diabetes. There's no particular topic. We're covering a vast amount of information here tonight. I shouldn't say vast. We're covering a lot of information tonight, and I want to make sure that we answer those. Like I said, the entire month is Diabetes Awareness Month, so we may come back and do some more later on. All right, so here we are. I've got my monitors, and I've got my glucose strip for the Keto Mojo and the Contour. Go ahead and get ow, 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 ow. Ow, that hurts. Okay, but I did get a good drop. That's why it hurt, by the way. All right, so there we go. And so 135 for the Keto Mojo and 129. And then you'll see on the screen the Dexcom says 123. And so let's go ahead and let's drop over here and let's see what my ketones are. And go ahead and drop in what do you think my ketones are going to be. I have been eating since Friday evening, so. All right, so we'll see what that is. If you think you have a guess, go ahead and drop that in there. And of course, we're not going to show you what that is right now. We'll come back and take a look at that in just a little while. Okay. All right, so let's go and let's have our conversation. And I do see, before we get into that, I do see another one of our community members out there. So, Pamela, here, hey, how are you? Let me get over here. We can pop that up. So we've got Steve saying hi to Teresa. Teresa saying hi to Steve. Hey, Steve. Pamela saying hi to Teresa and Steve. She said, discuss how it can affect your eyes. I love that. I love that. Steve is giving a guess. He says 0.01. 0.01. Come on, Steve. No, man. Give me a couple. Give me a little higher number. Teresa says 0.4. Okay, we'll see. We'll see. I bet you Steve might be right. I can hope, Steve. But I've not been eating keto. Okay. All right. All right. Here we are. So diabetes. Let's hop to it. And you'll see, I'm on the screen and I'm smiling. Okay. And you'll see next to me a couple of the things that you've seen before. New Year, New You. And then I think I mentioned that you're going to start seeing the infinity sign. And that's what I am attaching to the unlimited thought. And we'll come back. We'll talk more about that. Later this evening. And you will see more and more of that coming up. But let's get to diabetes. And the first thing I want to say is there is a lot that goes on when it comes to diabetes. Not a lot in terms of you being confused, but there's a lot of noise that you hear as we talk about diabetes. In the news, every time you turn, there's something about diabetes. There's a new diabetes drug, there's a new diabetes treatment, there's a new diabetes something, right, that's going on. All right? And we are tracking all of this data. And we'll talk a little bit about tracking data here in a minute. But I want you to take a breath, because sometimes it can seem as though it's overwhelming and it seems like you're going down, like you're drowning. In fact, when I have patients who are coming to me for the first time, one of the first things that I've got to do is I've got to break through all of the noise. I've got to get through to them to help them to understand that there is a lot in diabetes, but we can simplify it. It's not as complicated as it is made to seem. Okay? Not that everybody's trying to complicate it, but because of all of the conversations in the diabetes space, if you are not in the space, if you are a diabetic person who suffers diabetes, or someone who is associated with a family member, a friend, a colleague, somebody who has diabetes, and you're not in the medical, if you're not in the diabetes space, it can seem very confusing. And so we're gonna hopefully elucidate or get a little bit of clarity for you as we move through tonight. Okay. So first, let's talk about some numbers. And like I said, this is National Diabetes Awareness Month. That's here in the U.S. On the 14th is World Diabetes Day. So the numbers that I'm giving you right now are the numbers for the U.S. But remember, you've heard me say over and over, and as a matter of fact, I think I said it this evening at the top of the show, that there are over 1 billion people on the planet who have diabetes. And that's taking into consideration everyone, not just the people in the United States, okay? Everyone. So there are 38 million people in the U.S. that have diabetes. Yeah, 38 million. That's 1 in every 10, right? 1 in every 10 persons in the United States. That's a lot. That's a lot of people. And 1 in 5 people don't know that they have diabetes. So 1 in every 10 is diabetic, but 1 in 5 doesn't even know that they have diabetes. And then, leading into diabetes, 98 million people. 98 million people in the United States that are pre-diabetic. Now remember, pre-diabetes is having a blood sugar that's higher than normal, but not high enough to be called diabetes. And we'll see a slide here in just a little while that talks a little bit about that. So that's a lot of people. And so we're talking over 100,000. Sorry, we're talking about 100 million people. We're talking about over 100 million people in the U.S. alone that are diabetic and pre-diabetic. Now extrapolate that to the 1 billion that we talk about on the planet. Over 1 billion. Okay, that's a lot of people. And when we talk about diabetes, there are all kinds of complications that go along with it. There are money, cost, time complications. That is, for people who have to spend money on medication, one. For medications that have to be supplemented by medication assistance programs. For people who have hypoglycemia or other complications of diabetes and then they miss work. So the employer is losing money. The employer has to get someone to fill in for them, losing money. The person who's ill or can't go to work, they lose income, loss of money. The family for that person who didn't get to go to work, who didn't get the income, who needs to pay rent, loss of income. Now the landlord and the mortgage company, loss of money, right? So there's a cost beyond just the diabetic issues that we find people having, because it trickles into the rest of society. So huge. And then the toll that it takes on the person themselves. So blindness, like someone asked about, kidney problems, heart disease, stroke, loss of limbs. right? So all of these are complications that we see when it comes to diabetes. And the growing threat, as I said, of prediabetes is that it continues to be a big issue, continues to be a big issue in the United States. There are several types of diabetes. Two of the main ones, type 1 and type 2. Type 1 and type 2. And type 1 diabetes is typically diabetes that we see in our pediatric population, or at least we used to see it in just the pediatric population, but some things are changing. So we're seeing type 2 in kids, and we're seeing some type 1 in adults, called late onset diabetes of adulthood. Okay, so typically we saw diabetes in children, right? So in the old days, I guess I'm old enough to say the old days. In the old days, type 2 diabetes was not a thing, right? Type 2 diabetes is a relatively new disease process on the scene. And when I say new, I don't mean like the last 20, 30 years. I'm talking, longer than that. But compared to type 1 diabetes, type 2 diabetes is actually relatively new. And for type 1 diabetes, we are not actually quite sure what causes it, but we think that there is a huge genetic predisposition. So a person is susceptible, right? Their pancreas, for example, is susceptible, their body is susceptible. And then that's the genetic part of it. And then there's some environmental problem. So we believe it's an infection, and we believe the culprit virus is something called Coxsackie. It's basically a cold virus. So the person gets infected, they get a cold, and they don't even know, right, that this is going to be affecting their pancreas. And here's the thing. We don't know, because a lot of people get the infection, right? Many more people than develop diabetes. So what is making those particular people who do develop diabetes after this infection, what is different about them that causes them to be susceptible to the infection? We believe that there is, of course, like I said, a component of genetics that's plenty there. And so there's an autoimmune process that goes on. So an autoimmune disease is a disease where your body begins to fight against itself. So imagine that you got a cold and the body produced antibodies. They produce substances in your body to fight the cold. And so now the cold is gone. But the body wants to actually remember that they've had a cold, so if it comes back again, that it can fight it more readily. And so it creates these antibodies in your system, and those antibodies are just kind of floating around. They're waiting to get another cold virus that shows up. But while they're waiting, they begin to see other things in your body, and they begin to attack those inadvertently. I guess that's the phrase. Right? So they weren't intended for that. They weren't designed for that. They may not even want to do that, but somehow they get an affinity for something in your body, and they begin attacking it. That's how we get things like rheumatoid arthritis. So we're attacking joints, right? That's how we get lupus. That's how we get Behçet's, any of those types of connective tissue disease or autoimmune diseases. That's how we get type 1 diabetes, because it's attacking the pancreas. And when it attacks the pancreas, we get inflammation in the pancreas, so insulitis, that is insulitis, sorry. That is infection of the cells that make insulin, and then it destroys those cells, and then you get insulin deficiency, and that's how type 1 diabetes is developed. Type 2 diabetes, on the other hand, we believe there's also a genetic component. So people who in the family have type 2 diabetes tend to have type 2 diabetes. For example, you know people who are much larger than you would expect, and they don't have diabetes. And then you know people who are much smaller than you thought, who do have diabetes. And so the question is, what makes those people different, right? Because if we can figure out why the person who's 300, 400 pounds, who we would look at and say, that person has to have diabetes, and we go and we check, they don't have diabetes. The question is why, Because if we can figure that out, then there is there is something that we could maybe do for the people who are developing diabetes, right? Because there has to be something different about that person, and we just don't know what that is. The same thing for people who are much smaller who develop type 2 diabetes. Like I have some people in my office and they walk in and I say, surely that person is a type 1 diabetic, right? Because their body habitus, they're very thin, very small. And this is not a person who was big and lost weight. This is a person who's never been big. And they develop diabetes not as a child, but develop diabetes later on in life. And so what's different about those those groups of people? If we can figure that out, man, like if you can do that, Jennifer, Steve, Pamela, Teresa, if you're out there, if you guys can figure it out, remember, I'm your friend, right? So when you start making all the money, right here, okay? But anyway, so for type 2 diabetes, we think that genetics plays a part. And then, of course, lifestyle comes in. Notice that genetics and lifestyle. That lifestyle is going to come back in a minute. And what happens is we get abnormal secretion of insulin at that point. And so the insulin becomes ineffective. Either we're not able to produce enough, or the amount that we produce is not enough to do what we need to do. And so we develop diabetes. And so the whole idea behind diabetes is, and I have a little graphic here. Let's see if I can get to it. Yeah, here we are. And so the whole idea is that in your blood there are there's those white things. That's sugar molecules, and they're floating in the blood. And in order for them to get into the cell, insulin, which is that flower-looking thing, has to attach to the insulin receptor. And once it attaches to the insulin receptor, a channel is brought to the surface of the cell, and then the sugar comes in. So let's look at that again. So the white things, that's sugar, and then now the insulin gets attached to the receptor, boom, and then boom right there. And look at the big blob comes up, and when it attaches to the surface, notice that the white ball goes into the cell. So let's do that again. So sugar is floating around in your blood. And in order for it to get into the cell, the insulin has to attach to the insulin receptor. When it does, there's a channel created, and then the body basically sucks sugar into it. So if I don't have enough of those insulin receptors, or if I don't have enough insulin, all of those can be issues that we see. Another thought is, suppose I got enough receptors, I have enough insulin, but something is preventing that blob, that channel, from attaching to the surface, or it's blocked, right? So that's the whole idea behind some of the new concepts of managing diabetes, that maybe it's not that our insulin isn't working, or maybe it's not that we don't have enough, but something is blocking the insulin or the sugar from going into the cell. Okay? So that's the whole idea behind some of the newer thoughts of diabetes. And you've heard me say here that diabetes is an insulin issue. It's not a sugar problem. It's not a sugar problem. Sugar is actually just a consequence. Okay? All right. So that's type 1 and type 2 diabetes. So how do we diagnose? How do we diagnose diabetes? And we diagnose diabetes lots of different ways. And here's a good graphic to remember. All right. So we diagnose diabetes either with blood sugar or A1C or blood sugar and symptoms. Right? So that's it. So let's go through that. Number one, we can diagnose diabetes by looking at A1C. So an A1C of 6.5 or above is considered to be diabetic. That's the first column. 6.5 or above. 5.7 to 6.4 is considered pre-diabetes. You're at risk for diabetes. And then, of course, below that is considered normal. So a normal person has an A1C that's below 5.7. If we talk about blood sugar, so we can talk about fasting blood sugar. That's when you wake up in the morning before you've eaten anything. If your blood sugar is 60 to 60 to 1, so 99, then you're considered normal. 60 to 99 considered normal. 100 to 125 is considered prediabetes, and 126 and above is considered diabetes, right? So A1C, blood sugar, and then if you have a glucose tolerance test, that's, and we don't do this a lot now, except for people who are pregnant or people who can't do other forms of testing. Basically, you go in and you drink the orange stuff. It's called glucola. You drink it, and then they check your blood sugars 2 hours after. So at 2 hours, we expect your blood sugar to be below 200. So if you drank it and your blood sugar is 139 or lower, you're normal. 140 to 199, excuse my voice, is considered pre-diabetic, and then 200 or above is considered diabetes. Okay, so A1C, fasting blood sugar, 2 hour, and that's called the 2 hour postprandial blood sugar, right? 2 pp, glucose tolerance test. Or if you have symptoms of diabetes and your blood sugar is above 200 at any time, 200 or above, then you're considered to be diabetic. Even though we don't have an A1C that's high, even though we don't have a fasting number that's high, even though you didn't take a glucose tolerance test, if you show up anywhere and your blood sugar is 200 or higher and you're having symptoms of diabetes, then you're considered to be a diabetic. Okay, so that's how diabetes is diagnosed. And so what are the symptoms? And you should be asking, well, okay, so if my blood sugar is high, what are the symptoms? And there are a lot of different symptoms, right? You can have neuropathy, you can have pain in your hands, you can have numbness, tingling, right? Pain, hands and feet. You can have burning sensation in the feet. You can have blurry vision. Right, like, what is that over there? I can't see that. So blurry vision. Polyphagia means you're eating a lot. Right, people say, well, I just eat a lot anyway. Right, so polyphagia means you're eating a lot. And you're eating a lot. Why do you think you're eating a lot? Well, you're eating a lot because the cells think they're starving. So even though your blood sugar is high, that blood sugar is not getting into the cell, so the cell thinks that it's starving. And so it makes you eat. And then polydipsia, meaning drinking a lot. And you're drinking a lot because you tend to pee a lot. So if you're peeing a lot, then you're losing fluid, and your body makes you drink to replenish the fluid, and then you go pee again, and then the cycle goes over and over and over. Okay? If your blood sugar is 180 or higher, then you'll start peeing. You'll start peeing more. That's the threshold, 180. Or you could be very sleepy. People are very much sleepier, more tired than they were before. Or you can have skin tags, right? So sometimes when people see these will come up, they say, oh, I just got a new skin tag. Well, that can be a sign of insulin resistance. Or something called acanthosis nigricans. This is a darkening over the neck, the nape of the neck, under the arms, the elbows, the knuckles, behind the knees, the kneecaps. So all those places, high insulin will cause them to get darker. And so sometimes people think, oh, that person didn't wash their neck or something, but it's not that they didn't wash their neck. It's just that they're having hyperinsulinemia. So that's what it looks in a person who has darker skin. And then if you have lighter skin, this is what it will look like. Okay. And then, of course, weight loss. And people will say to me all the time, oh, I've lost a lot of weight. I'm doing good. Well, no, it's not good weight loss, right? You're losing weight because your body thinks it's starving. And then people will get itchy skin, dry, itchy skin. They'll get cuts that won't heal properly. They'll get problems with their gums and their teeth. They can have problems in the bedroom, so sexual dysfunction. So all these are symptoms, signs of diabetes and hyperinsulinemia, prediabetes, right? Or GI distress. And of course, we talked about pain in the feet. Now, we talk about that, but remember, blood sugars cover all parts of the body. Every cell in your body is covered with high blood sugar if your sugars are high. And so the triopathy, neuropathy, retinopathy, and nephropathy. So these are the places in the body that we tend to hear a lot about. So the high blood sugars will damage nerves. And when they damage nerves, we get what's called neuropathy. Now, neuropathy simply means damaged nerves, right? It does not mean diabetic. Because you can have diabetic neuropathy, and sometimes we leave that first word off. We leave the diabetic part and we just say neuropathy. So people assume that neuropathy only comes from diabetes. But no, you can have diabetic neuropathy. You can have trauma-induced neuropathy. You can have compression-induced neuropathy. You can have medication-induced neuropathy. You can have cold-induced neuropathy. Right? So there are a lot of things that cause damaged nerves, because that's all it needs, damaged nerves. So it does not have to be just diabetes. And you've heard me say, if you've been following us, particularly on our in our fasting check-ins, you've heard me say that one of the things that helps with neuropathy is autophagy. So if you don't remember, if you don't recognize that word, go back and watch one of our shows. But autophagy is the body's cellular cleanup process, and it helps to repair damaged tissues. There you go, damaged tissues, right? So neuropathy. The next one is retinopathy. So in the eye, there is a let's do it this way. Yeah. So within the eye, think about let's see how to describe it. I want you to think about having a piece of foil, right, that is lining a cup. Lining a cup. You get a cup, and you got a piece of foil that's lining the cup. Well, what happens in retinopathy? The retinopathy will cause either bleeding in the eyes, and so when it bleeds, then the back will get filled up with blood, or the vessels that are supposed to be basically paper thin so you could see through them, now there's bleeding and they become thicker. So as you're trying to see, you're actually seeing a vessel, right? So if enough of those get big enough, then it clouds the vision, or the foil in the back of the eye begins to tear away, right? So all those things can happen when it comes to diabetes. And that's called retinopathy. And of course, nephropathy is damage to the kidneys. So you could think of the kidneys kind of like a sieve, right? A strainer. And diabetes causes the holes to get bigger. And so things that aren't supposed to pass through the holes will pass through, and that's called microalbumin. And so it's a sign, it's a marker that there is starting to be some issues with your diabetes. Okay, so nephropathy. So those are the triopathies. So if you do have questions, go ahead and drop those in. I see some comments, so I'm going to hop over there and just grab some of those here really quickly. Let's see what we have. Where we saw everybody saying hello. Teresa said, discuss how it affects your eyes. So Teresa, I hope that answers your question. Hi, Jennifer. Jennifer says, I'm a celiac. It's not fun if I get into gluten. Can't have oats either. Joints inflamed, then I can't walk or bend. Yeah, so autoimmune diseases. Right, all of those autoimmune diseases. Excuse me, I'm not sure what's going on with my voice tonight. Other than I think I'm catching a cold. Teresa say, Jennifer, hi Jennifer. Hey Teresa, Steve, Doc, smiley face. Good evening all. Hello. Hey Lightworks, what's going on? Welcome. Howdy Works and Riri. Hey Riri, how are you? Good night everyone. Hi sis. Hey Riri. Hey bro. All right, glad that you guys are here. So we're just doing a kind of review for Diabetes Awareness Month, kind of review of diabetes and talking about some of the things that you will see, some of the things you will hear, right? So the triopathy, and that's what this is called, nephropathy, retinopathy, neuropathy, or neuropathy, retinopathy, nephropathy. And if you go back to symptom-wise, remember we just talked about some symptoms. I talked about, and let me back up there really quickly. Boom, boom. I think it was two more. All right. So we talked about polyuria, polydipsia, and polyphagia, right? The polys, right? Polyphagia, polydipsia, polyuria. Those are the three common symptoms that you will see when it comes to symptoms of diabetes. So when I said if you have a blood sugar of 200 and over with symptoms, those are the most common symptoms that people will have to say, okay, yeah, we're classifying you or we're diagnosing you now as a diabetic. Okay, and of course, we have the numbers. So if you get labs, those labs will confirm that sometimes, right? So there's possible for someone to have blood sugars that are elevated and their A1C is not high yet. Yeah, because we caught them early. All right. So when we talk about diabetes, what then is our goal for diabetes? All right. What is our goal for diabetes? And most people will first, when I ask this question, most people will say that the goal for diabetes is to control blood sugars or to get an A1C of a certain number. And that really is not our goal. Our goal is to make sure that these people become these people. What does that mean? Our goal, when I talk to my patients and I talk to my clients, I tell them my goal is to help you to live as long as possible and be as healthy as possible. Because here, let me ask this question. So let's assume that we could guarantee that you would live to be 100, right? Somehow we made an agreement with the Almighty and says, look, can you guarantee that this gal is going to be 100, and can you guarantee that they're going to have a healthy life, right? So 100 years old and healthy life. If that were the case, you wouldn't care about blood sugar, right? Because you've achieved the goal. The goal is long life, as healthy as possible, right? So the blood sugar at that point is incidental. So it's not a blood sugar issue. So if I can get somebody to live long, then blood sugar doesn't matter. The problem is that we don't know which person is going to live to be 100 and not have complications. So we then say, hey, we've got some A1C goals. We got some other goals that we need, because we know if we can keep the A1C reduced, then we can decrease the complications that the person will go through, like heart attacks, eye damage, kidney damage, and you'll see the numbers there. Anywhere from 16 to 34% decrease in complications, according to UKPDS study that was done years ago. This is a type 2 study. And when we talk about type 1s, we know that if we can keep the A1C down, then we can decrease complications for them between 56 to 76% in terms of eye damage, nerve damage, and kidney damage. That's huge. So that is why we are so intent on managing and controlling diabetes, right? Because those are the treatment goals. And so when we talk about an A1C, what is the A1C goal? An A1C goal is less than 7. Now, let me hasten to say that the A1C goal that we talk about for the general public in our traditional management of diabetes is less than 7. That's what we say. Now, in the space of being whole and wellness, and as we've been talking about, we're talking about putting diabetes in remission. We're not satisfied with less than 7, right? Because we're pushing that thing as low as we can off of medication. So that's the goal. But if you go to your doctor, or as a matter of fact, if you come to my office and you're talking to me in my office about what is our goal initially for your blood sugar or A1C, my goal is less than 7. As a matter of fact, I tell people 6.5. Now, once we get you to 6.5, then we can talk about, okay, what do we do now to begin backing off of some of this medication and still being able to drive that A1C down? Because if we get your A1C below 5.7 and we keep it there for 1 year off of medication, then according to the criteria, you've now entered remission. Okay? So our goal set less than 7, but we want to push that as much as we can. So as you are, as you know, one of the challenging things is to have someone come in to the office as a new patient, and I know where I want them to be. It's actually less than 5.7, but they're at a 14. We can't even talk about 5.7. Right? Remember, probably can't even talk about a 6.5. All right. So we've got to get there. We've got to get there. And for most of my people, and you, if you've been to my office, you know, my goal for you is you get 4 A1Cs. Before you have 4 A1Cs, and we're intensifying therapy all the time. And if we're moving and those A1Cs not getting where we need it to be, then you get insulin. And people say, well, why would you put me on insulin if you try to get me off medication? Well, first I've got to stop the boat from going down. I got to keep you alive first. Right? So 4 chances. You get, well, 3, really. Or we go on insulin. And we do that until we are at the point where we can say, okay, now you've learned the things you need to learn. How do we begin backing off? So people say, well, that goes against what you teach. No, it doesn't. First, keep the person alive. Boom. Once you keep them alive, then you can teach them all the stuff that we're learning. But if they're not alive, then it doesn't matter new year, new you, because it's new year, know them. Right? All right. So let's see. Where are we? Okay, so that's our A1C goal. So when it comes to type 2 diabetes, and so remember, we're talking type 2. Type 1 diabetes, we have not been able to find a way yet to prevent type 1 diabetes or to reverse it. We don't have it. It doesn't exist currently. Or if it exists somewhere that we haven't found it yet. So for type 2 diabetes, the question is, what comes first, the chicken or the egg? Did the weight happen first and then the insulin issues, or the insulin happen and then the other stuff? Well, yeah, it's a very good question. And right now there are a lot of people that are on insulin. There's a little guy, and my youngest patient that I've ever taken care of who had diabetes, I think was like 6 months old. So it's a huge issue. But the body is kind of like a car. It has an amazing capacity to do things. And if we take care of it, then it can last a long time. Or it's like that little seed that you put into the ground, and that little seedling comes, the little sprout comes up, and it's very delicate. And if you take care of it, then it can grow to be a huge oak. And so the question is, what are the tools that we have in our armamentarium? What are the tools that we have that we can use to manage our diabetes or take care of our diabetes? And they come in lots of different forms, and we're just going to run through them quickly. We're not going to spend a lot of time in this first area. So prescription medication. All right, so we got oral medications, we got non-insulin injectables, that's the GLP-1s. We've got insulin, we've got technology, and you guys see some of the technology that I use here. We've got insulin pumps, we've got sensors, blah, 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 and on and on and on and on. And we've done diabetes for years and years and years, and we actually know how to manage blood sugars. Notice the words I'm using. We know how to manage blood sugars. Like, I can take somebody, bring them to the office, and I can get, if they listen to me and they work with us, as they work as part of our team, we can get their blood sugar down. Not an issue. But as I've asked before, well, where does the sugar go? And what other things, what other complications are we getting because of the management? Okay? So oral medications, and there are a whole host of them. We've done shows before we went through each medication. In fact, at the beginning of this process, we did a show called Which Medications Should You Start? Which medications should you get off? And those are good places to go back and kind of review medication. If you're interested, we can go through that again. Okay. All right. So here's the challenge, though. The challenge is that despite all the things that we do, despite all the medications that we have, Despite all the years that we've been treating diabetes, the complications, the risk of obesity, and ultimately the risk of diabetes keeps going up. And you'll see there, right? This is percentage. Right, so we started out, in 1990, 1999, the year 2000, 30% of the U.S. population were obese. In 2018, 42%. And they tell me here in 2050, I believe is what it is, then over 50% of the country is going to be obese, and a large portion of that is going to be diabetic. So despite all the things we're doing, it's not quite working the way we want. And so remember we talked about, hey, how do we treat the car? If we do the things that the car needs, if we take care of it, then the car is going to work. And so this is where this whole concept of lifestyle modification comes in. All right, so we did a show called Damn Sick: Diet, Activity, Medication, Sleep, and Insulin, Inflammatory, and Cortisol. Right, so diet, activity, cortisol, inflammation. If we take care of the body, then the body gets better. In fact, if you go and look, all the guidelines are now starting to say, hey, make sure that you're including diet and exercise, lifestyle modification, and all those things into the treatment of diabetes. And so this is things like diet, and we spent time talking about diet, activity, sleep, managing stress, managing depression, anxiety, managing your pain, managing your inflammation. Because all of those things will cause blood sugars to get higher. And they can cause complications. So if we are doing a job of taking care of those, then we get better. Okay? So let's run through a couple of truth and not truth and dare. But so diabetes is not a sugar problem. Diabetes is not a sugar problem. That is a truth. Diabetes is an insulin problem. When we're talking about food, we are never chasing food. That is a truth. We're always chasing what the food is doing for us. Either it's providing nutrients, providing comfort, bringing back a memory, it's a friend, it's causing us to be calm, it's a companion, we're not lonely, but we're not chasing food. That's the truth. You may not always have symptoms for diabetes. That is the truth. A lot of people don't have symptoms until they have that symptom. People don't know they're diabetic until they show up with a heart attack, or until they have some erectile dysfunction, or until something else is going on. But yeah, right? You don't have to have symptoms. You can modify your risk, and that is the truth. You can modify your risk. You can reverse diabetes, and that is the truth. When we're talking to type 2 diabetes, though, that is the truth. And then, of course, have to throw this one in there. Fasting is safe if done right. Yes. Fasting is safe if done right. Okay. So we're going to come back. We're going to talk about a couple of things here in just a minute. But let me hop back over to our comments and see what we have going on over there. Let's see. Let's grab this one. So Teresa says, yes, sir. It answered my question. Riri said, I found out last week that I have a heel spur on my right foot. I Googled it and it mentioned it comes from having very low vitamin D levels. So there are a lot of things that can happen bone-wise, right? Because remember, one of vitamin D's jobs is to get calcium out of the blood and put it into bone. So that if the vitamin D is low, what happens? The body needs calcium, so it goes to the bones and it begins breaking the bone down, and that can show up in lots of different ways. Okay? Reva says, so now exercising for me has now become a little harder, not to mention arthritis in my hips and bones. Okay, yeah, so I would make sure that we get that vitamin D treated. I went to my doctor recently and my vitamin D was low, so he has me on some vitamin D too, Riri. She said, my A1C is 6.7, fasting, but I'm not on any medication. That is, I love it. All right, so now the question is, how do we get it lower? Okay, so 6.7, great, right? So that's less than 7, yay. like we said, treatment goal less than 7. But if we're talking about remission, how do we get that A1C even lower than that? And the tools that we've been using are ways to be able to do that. We'll come back. We'll talk about that in a minute. She said, I got it down to 6.1 with exercising and cutting out sugar and rice, but now it's back up to 6.7. So what did we do differently is the question. What did we do differently? Okay. All right. So how do we then manage or reverse diabetes? And this is where our conversation comes in. New year, new you. Traditionally, how we manage diabetes, right? Kind of like going to Riri's point. Traditionally, how we manage diabetes has been to say, go home and eat better. That's it. Eat better and everything is going to be great. No. Because there are components to what we do. Like Riri, right? She knew that if she ate rice, they was going to go up. Or maybe I'm stressed, and so I eat something. Or I'm stressed, or I have pain. I think, was it Jennifer who said that she had some celiac, right? So all of those disease processes will affect blood sugar. And so the things that we've been walking through in how we manage our diabetes, right, to put us in position to be successful in getting these numbers where we want them to be. That's the process. And it's not meant to complicate life. It's meant for us to have a structure that we could tap into at any time. Think of all the things that we've done in the process, the New Year, New You process. All the things we've done are things that are accessible to you. You don't have to go out and buy new food. You don't have to go out and research. They're very simple, practical things that you can do. Right, we're going to come here in a minute. We're going to talk about balanced bites, right? And you'll see the components of balanced bites. And I today in the office, I was talking to a guy, and I had to explain that when I say, and I guess I should stop saying it, but no, I'm not going to. Like, I'll say to people all the time, I said, I really don't care what you eat. Right? I'm not the food police. You're an adult. What I will say, and I will never tell people there's something they can't eat. Those words never come out of my mouth. Now, if you know that, you've got, I don't know, allergy to something, or you've got intolerance to something, that's your job to kind of monitor that. But aside from allergies, everything else is fair game. And so as adults, we get to manage what we put in our mouths. So I'm not walking around trying to take your food away. What I do say to people is you have got to understand how to use that food effectively. You've got to understand how to, like I asked the guy, was it last week? Came to the office and said, hey, do you like pizza? Well, we were talking about different food. He said, do you like pizza? I said, yeah. He said, I love pizza. I said, well, how can you eat, as a diabetic, how can you eat an entire large pizza? He said, well, I can't because I'm diabetic. I said, well, that's not true. So who thinks they know that? Put it in the chat. I'm not going to tell you yet. If I, as a diabetic, I want to eat an entire pizza. There are 8 slices in a pizza. I want to eat the entire thing. How can I eat it and still maintain good blood sugars? Right? So I'm not going to put it yet. You guys put it in there and we'll come back. Well, I'll say that. Okay? So then the New Year process, New Year, New You. It is a process. It is a lifestyle that we're adopting. It is not a a quick thing here, quick thing there. It is not something I do for 2 days or 3 days or a month. It is something that I'm putting in place for the rest of my life. It is something that I'm going to have to practice. It's something I'm going to have to get used to. It's something I'm going to have to implement. I'm going to try something. This is going to work. That's not going to work. I'm going to fall down here. I'm going to pick back up, and I am going to keep going because it is a process. It's not going to work the first time. It's not going to work the second time. But if you keep at it, you will get some success. And we're not trying to do 100%. We're not looking for 100%. Right? Remember, one of the reasons that we sometimes don't succeed is because we're looking for perfection. We are not looking for perfection. What we're looking for is we're looking for progress. And that's why I love this next one, the heat model. The heat model acknowledges that there are things in our lives that will make us do, food-wise, things that we have decided we're not going to do. Other than that, we kind of ignore it. Everybody pretends that it's not happening. Like, we got Thanksgiving coming up here in a little while, Christmas, anniversaries, birthdays, New Year. And a lot of people are going to pretend that they're going to go to their family function and they're not going to eat the stuff that's on the table. Yeah, right. We know it's going to happen. So acknowledge it, give a name to it, and then own it. It didn't just happen. Habits, emotions, access, and taste, these things. If we can do these things, if we acknowledge them to the New Year process, we got the heat model. These are the things that tell us what are the things that are going to push us, push our buttons. And now we get a chance to circumvent those, to put things in place to help us with them. Unlimited. The unlimited idea, right? Because you can make choices now. There are people right now who have kidney problems, eye problems, they've got nerve problems, damage, and this is all stemming from their diabetic. And they're sitting right now and they are frustrated, they're depressed, they are mad at themselves, they have regret because of those things that happened. Those things have happened, they are in the past. We can't change that. But I can promise you this, that starting right now, you can make decisions. You have unlimited ability to make a decision, to chart the course of your destiny. So you don't have to be one of the people who are in the whatever number of people I just told you a little while ago. 1 billion. All right? So you can make a change. You have unlimited ability to do that. And here is and Riri. So here is the idea, right? Balanced bites, right? And so this, for those of you who've been following us, this comes directly from one of our challenges. Remember, whole foods, minimize processing, no added sugar, lean protein, healthy fat, starchy, non-starchy vegetables, tasty, flavorful, and portion controlled. Balanced bites. So fuel your body with balanced bites. Every bite counts. Now, that doesn't mean that you have to stress over every bite. In fact, there are going to be some bites that you take that are full of sugar. But you have to understand where that bite fits into the scheme of everything that you're eating today. Like, I wish I was trying to find it today, but I went to, I think I told you guys, I went to DC like 3 weeks ago, and then last week we went to Boston, and let's see if I can find it. And I was driving. I was minding. Let me say this. So I was minding my business. Did I say that? Yes. So I was minding my business, and I was just driving, and lo and behold, I rounded a corner, and of course I can't find it. I was trying to find it today. I rounded a corner, and as I rounded the corner, I looked over to my right, and what did I see? Was a sign that says Ben and Jerry's Ice Cream. It was a whole store, y'all. A Ben and Jerry's ice cream store. Can you believe that? A Ben and Jerry's ice cream store. And you know I pulled over. Of course, as it would happen, it was late. See, is this it? Yeah, there it is. Okay, hold on. Watch. Hold on. Let's see. Let's go back here. Da, da, da. Okay, you're not gonna hear anything. I don't think. Let's see. Can I think I turned off that. Yeah, you're not gonna say anything. But look at that. See, Ben and Jerry's ice cream. Let's do that. There it is. A whole store dedicated to Ben and Jerry's. I thought I'd lost my mind. Right? So those things happen, right? So balance bites. But for the most part, if we keep in mind this idea, then we are conscious, right? So once again, we're not looking for perfection, but what we're looking for is the general tenor, the general trend of what you do should be balanced. The general trajectory of what you're eating should be balanced. And people say, well, I can't do it perfectly. I'm not looking for you to do it perfectly. But it's better than what we have now. Right? And then remember, right? What are we doing? We're decreasing insulin, we're suppressing our appetite, and we are reducing sugar. Those are the pillars. And that all comes as we are educating, empowering, and encouraging. So how do we treat diabetes? How do we reverse diabetes? Is understanding the things that go into diabetes, what diabetes is, how it affects the body, the complications, polyuria, polydipsia, polyphagia, what complications we can have, neuropathy, nephropathy, retinopathy, and then understanding that we have the power. We have unlimited ability. All right, you guys heard me say we're gonna use that infinity sign. We have unlimited ability to make change and to chart the course of our destiny as we move into the future. All right, so that's how we get over that 1 billion that we're talking about. The 98 million people in the United States who are pre-diabetic. The 38 million who are diabetic, the 50% of people who are overweight. I'm going to create a slide that had the statistics of diabetes, obesity, pre-diabetes, high blood pressure, high cholesterol, heart disease, stroke. I'm going to make that so we can see those numbers because they're huge. And what we've been doing is not working. So new year, new you. Riri, were you laughing at me? I saw you laughing in there. Let's see. Let's go back up here. So Teresa says, change what the pizza is made of and when you eat it. Okay, I like that. I like that, Teresa. So yeah, change what it has. So you can do cauliflower. I don't know, Riri, I don't know if you saw the show where we did the cauliflower pizza. And she said, I like your answer, Teresa, but he might have a different answer. So I like that. She said, I'm carb addicted. As soon as I eat carbs, then I'm jonesing for more. If I stay away and not eat any carbs, then it is easier to stay away. So here's the thing. And I love that you say that, Riri. And you know what? I am glad that you recognize that. So here is why that happens. Once you eat some carbs, then your body has to bring the blood sugar back down because the blood sugar is going up. And because the body has to bring the blood sugar back down, then you will have to produce insulin. Your body produces insulin to treat the sugar. Once the insulin comes out, the insulin stimulates your appetite. Yep. And the drop in blood sugar that your body experiences when the blood sugar is being treated with the insulin your body made, that also stimulates appetite. So that's why, like you said, if you don't eat any carbs, you can go for days and days and days, maybe even weeks without eating carbs. But the moment you taste them, then all of a sudden you need more because the appetite is stimulated. And so you have to understand yourself. You have to understand what carbs are the ones that push your buttons. That's what that heat model is about. The heat model says that there are some specific things in each of us that we've got to be aware of. And then what you're going to do is you're going to find ways to manage that. So I can't tell you, even though I was at the Ben & Jerry's ice cream store, right? I can't tell you the last time I had Ben & Jerry's ice cream. You know why? Because Riri, I'm like you. I understand myself. And so right so right now, you know where my big challenge is, Riri? My big challenge is because Christmas is coming soon. And at Christmas time, they're going to have eggnog. And I'm like, if I had to put in order the things I like, right? So it would be Ben & Jerry's ice cream, eggnog, and almonds and cashews, right? In the list. And I'm not really sure where Ben & Jerry's and eggnog are. Like they're fighting each other. Right? Now, add on that, right? So it's not just that I like eggnog. It's not just that it brings back the memory of my dad making eggnog, right? Because there's all of that emotion, all of those memories that are piled on top of it. But there's also this concept of scarcity. And scarcity says, I don't know when I'm getting any more, right? Because it's coming out at a certain time of the year. All the refrigerators are going to be filled. And then come, the 24th or 25th, it's going to disappear. So when I walk into the store, I'm fighting all of that stuff. And I have to understand that and be able to manage it. Right? So if you guys want to all come to Huntsville and help me out with this, come on. All right, let's see. Riri said LOL. Teresa says LOL at the store. Yes. Jennifer said, this is evil, pure evil. Now I'm Joseph. Oh no, Jennifer. That's right. It could be a trigger. It can be a trigger. Right? LOL. So Jennifer, here's the thing. Imagine being in the office talking to people about food all day, every day. Right? Because I hear about all their, I'm not even going to say the stuff that they talk about. Right? But it's good stuff. And of course, everybody wants to bring stuff. Like in my office, for being an endocrinologist office, you can't imagine the amount of sugar that passes through my office. Right? And so I'm there, and I'm like, okay, I'm not having it. And I tell my team, you got to take it home with you. Right? I'm gonna have that little piece, but you got to take it home with you, because if it stays here, right, you guys might come back tomorrow, and I'm still here sitting in front of the refrigerator, like, out of my head. Lightwork said, not a whole store. Yes, a whole store, Light. It's a whole store. He said, I'm banning Halloween next week. I'm eating the candy the kids collected to protect them, but it's not helping me. Oh. Yeah, go back and watch the show where I talked about on a Halloween night. I actually threw. So here, so guys, let me tell. So I got a trash bag this morning, right? Because I was here all weekend, right? So I got a trash bag this morning. I had a full can of nuts. I had like 3 bags of candy that I took out of the candy that we put for the Halloween people, for the kids, right? Yeah, I stole the kids' candy. And then what else did I have in here? So I took them all, put them in the trash bag, tied the trash bag, and put it in the dumpster. I mean, in the trash. See, I'm bowing, and Riri said, "Get some Ben & Jerry's eggnog." Riri, you are so bad. Did you guys see what she says? She says, get Ben and Jerry's eggnog ice cream. Oh, is there such a thing? Okay, so so you're gonna make me Google. Is there a Jerry's eggnog ice cream? Jennifer said, "Oh my God, I love eggnog. I make it from our farm fresh eggs and heavy cream and milk from the neighbor's dairy." Lightwork said, "Now I want some home chicken from the Virgin Islands." Okay, okay. All right. So enough talk about food, right? Enough. Nobody say anything anymore about eggnog. Okay, no more eggnog stories. But here's the thing, right? And so we're gonna do a show not this coming week, I think the next week, and the show is going to be actually the last two shows I think are going to be about holidays and some thoughts on holidays because as you see, right? As you see the concept, it's real. It's real life. I tell people all the time. I mean, if I pretend that you're gonna go home and you're going to execute 100% the things that we talked about, I'm setting myself up for failure, and I'm actually setting you up for failure as well. Right? But understanding that there are things that we're going to do, but that we have to manage those things is a huge component of this whole process. But you do have unlimited potential, unlimited ability to do the things that you need to do to set yourself up for success. It is infinite. I love it, love it, love it. All right. So let's get back and let's see. I'm supposed to do something else. So you guys got me off track. But I love the conversation. I love that. And for all of you who are in the chat right now, Riri, Jennifer, Teresa, and all of you, Lightworks, thank you for your honesty. Okay? And Pamela and Steve and all of you who are there. I know Pamela and Steve didn't say much tonight, but I want you guys to understand that when you talk, when you share where you are, there are other people who are watching, other people who are listening, who are saying to themselves, "Oh my God, it's not just me." Because there's nothing like feeling like you're alone. That loneliness makes you eat. But to see, oh my God, there's somebody out there that's having the same issue. It may not be the same food. It may not be the same circumstance, but there's somebody else out there that's like me. Like I've had people say to me, like, I can't stop thinking about food. They said, I eat breakfast, I'm thinking about what I'm going to have for a snack. I have a snack, I'm thinking about what I'm going to have for lunch. When I have lunch, I'm thinking about what I'm going to have for dinner. People who say to me, man, I'm going home on the weekend, and I know we're not going to go back out for, unless something happens, right? We don't have any plans. We're going to be at the house. And I begin panicking because I wonder, okay, do I have enough snacks at home to get me through the weekend? That's a real thing. And if you pretend that that's not happening, then that's a huge issue because it sets you up for not being successful. So how do we manage diabetes? We manage it unlimited with educating, empowering, and encouraging. We get the tools, we do the things we need to do, and we set ourselves up for success. That is what New Year, New You is all about. As I say, I'm always glad when you are here, when I get to spend some time with you, when we get to interact and we get to kick it like we did. So thank you for participating, for being here. Join us later this week as we do our check-ins. Well, let me do this real quick because I know Steve's going to want to know, and you guys are going to know what what my ketones are. So let's do that, and then we will go. So I still got the Ben and Jerry's thing right there. So let's see. Let's grab this. Oh, not that one. Let's grab this one. And let's pop that up and get this syncing. Let's see. While we do that, now I want to. So Steve said, as I broke my fast today, I thought about you. Part of my meal was cashews and macadamians. Oh, see? So Steve understands. All right, drum roll, please. Oh my goodness, Steve, you weren't quite there, but you were close. Right? So 135 was my blood sugar and my ketones 0.1. You'll see that there. And remember, ketones that are less than 0.5 are considered normal. So I'm in the normal range. 0.5 to 1.5 considered nutritional ketosis. And then above 1.5 considered therapeutic ketosis. And if we look at the actual graph, you'll see here when I started eating, when I broke my fast, look at the ketones going down. There's the turquoise line. And then, of course, the tan line going up, those are blood sugars. Because blood sugar, so ketones and insulin can't be in the same space. When blood sugar goes up, insulin goes up. When insulin goes up, ketones have to go away. Okay, so as I started eating, my insulin started going up, and then the ketones drop. Awesome. All right, so join us again for our fasting check-ins that we're going to be doing later this week. We've got videos from the vault on Saturday night at 9 p.m. Central. This Week in Review on Sunday at 6 a.m. Central. Of course, Dwain Woode, MD, live here next Monday at 7 p.m. Central. If you have not done so, make sure you get over to our YouTube channel and look through the playlist. There are a lot of things out there that we're doing. And we will see you. We've got several shows that we're going to be doing this week, and you will begin seeing some of these things popping up, like Balanced Bites. The infinity sign will pop up as we are getting over the next several weeks, and as we prepare for what we're going to be doing coming up in the new year. Because new year, new you, does not mean new year, new 2024. New year, new you means new year for the rest of your life. So thank you for being here. Everybody, have a great evening. We will see you on one of our other shows. This is Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life, avoid complications, and go to the next level. And in this year, new you. Good night, everybody.